Welcome everyone. We just have a minute or so before we'll start. Just a reminder to keep your microphones on mute, please. All right, welcome everyone. We'll go ahead and get started. Welcome to this SSH webinar, Sim Series webinar put on sort of quickly here, but we were really thankful for our presenters, Katie Waxman and Carol Durham, to help us navigate treacherous waters that is COVID-19 right now. This webinar is entitled Use Simulation to Replace Much Needed Lost Clinical Experiences Due to COVID-19, Strategies and Recommendations. It's my pleasure to introduce to you today's presenters. Dr. Katie Waxman is a national nurse leader and executive with over 30 years of experience in healthcare and corporate settings, associate professor at the University of San Francisco and director of the Executive Leadership Doctor of Nursing Practice program there. She also directs the California Simulation Alliance, and she is an internationally known speaker and author. She is also our immediate past president of the Society for Simulation in Healthcare, along with serving with the Association of California Nurse Leaders. She's a past board member, treasurer, also of the American Association of Nurse Executives. So welcome to Dr. Waxman. Dr. Carol Durham has made significant contributions in interprofessional education and practice. She is at the University of North Carolina, Chapel Hill, Durham, sorry, she prepares faculty to integrate quality and safety into their teaching using simulation as a methodology. She's a member of the Robert Wood Johnson Foundation's Quality and Safety Education for Nursing, or QSIN, project, and she's developed simulation-based educational experiences that reflect cutting-edge pedagogy. Dr. Durham has made significant and sustained contributions in IPE and is a leader in preparing faculty to integrate quality and safety into their curriculum and their teaching. In addition to being engaged with the Global Network for Simulation in Healthcare, or GNSH, she is also a past president of the International Nursing Association for Clinical Simulation and Learning, or INACSL, and welcome to Dr. Durham. I'd like to turn this program over to them. It is reminding you that to keep your microphones on mute, we are recording this program so that it can be accessed later. And there will be some resources shared by the faculty today that we will be posting on our COVID-19 resources page at sshih.org. With that, I'll turn it over to Dr. Katie Waxman.
Thank you, Kathy. Hi, everyone. I bet that many of you are becoming Zoom experts. I know Carol and I have been on Zoom every hour, all throughout the day. And so we're very familiar with this platform and glad you could join us today for the using simulation to replace a much needed lost clinical experiences due to COVID-19. Strategies and recommendations. And Carol and I are going to work together in today's webinar. So we'll be going back and forth. I'll be running the slides and Kathy and the staff will help with the chat. If you have a question, just put it in the chat. And when we get to a certain point in the presentation, we are going to put a link in the chat that you can actually click on to follow along with what we're talking about. So that's me. And that's Carol. Our disclosures. I am a consultant for health impact and the California Simulation Alliance. And you can see Carol's disclosures there. We want to, before we go into the learning objectives, we just want to disclose that our views are not representative of the views necessarily of the Society for Simulation in Healthcare, or INACSL. We are reiterating many of the things that are on their website, but our views are our own, and we wanted to disclose that early on. Both SSH and INACSL have resources on their websites and are working closely together to make it the most current information possible, and we will be reviewing some of that today. This morning I saw on Twitter that INACSL tweeted that they believe that substituting virtual simulation for clinical hours requirements is critical to prepare students to enter the workforce. I would check their website for that statement, but this is sort of in line with that. There is some controversy out there that some do not believe we can do that, and we will talk about that as we get through the presentation. But right now, the purpose is, how do we, given this crisis, utilize a virtual environment, whether it's Zoom, whether it's software, whatever the case is, to get these students their clinical hours and continue to train faculty who need training without leaving our homes. So our learning objectives are to discuss strategies to utilize online SIM to meet course objectives, and talk about the value of SIM. We continue to talk about the value proposition, and some of us have convinced our state boards of nursing that, and they have accepted, up to 50% or more. Others have not been able to identify the value of simulation, and we'll talk more about that. Analyze the use of different simulation modalities in online learning, and then we're going to go through the latest and greatest simulation regulations in most states and what's going on. So I'm going to turn it over to Carol to talk about COVID as a disruptor.
So I think that COVID-19 is a disruptor to many things, actually, but to healthcare education in particular, I would like to speak to. It's really a change in the paradigm in which we are educating our learners. Within 1 to 2 weeks, all of our pre-planning for spring 2020 that we were halfway through in the midst of delivering became topsy-turvy. And so we were thrust into planning for and teaching online. And so, not to be confused with online teaching, which actually takes a lot of other training, we are actually doing remote teaching and learning, not online teaching and learning. And so we want to make sure that we are not trying to be perfect, because it's the enemy of our good, and we are really trying to regroup and establish meaningful learning for our students in this interim period. And the uncertainties around it are really complex, because we don't even recognize how long it's going to last or how we're going to navigate all the different pieces. I know we're in the midst of planning for spring and other contingencies, and a lot of time is spent across the nation with educators figuring out what's the next contingency we need to figure out. But I'm asking you to be kind and patient with yourself and your learners in this time, because it is a stressful time, not only in trying to finish out degrees or programs of study, but also managing yourselves and families in this time of a clinical healthcare emergency. Go back a little bit, please. Thank you. So in clinical and lab, we have many clinical sites that are dismissing their students, and most all of them have now. And the faculty are charged with creating this virtual learning that's really important. And we have to remember it's important to keep engaging our learners in strategies for clinical reasoning. We have to understand that the transference of a case study that you might have that's really worked really well within a classroom doesn't necessarily work well in a virtual learning unless you do something to make it more engaging. So, and it's hard actually to do hands-on learning. And one of the questions that we got pre-webinar was around that hands-on learning. How do we actually do the things that we used to do in person to validate skills? And that is one of the things that I don't have a magic bullet for. I don't know exactly how do we actually do that virtual assessment, say, of a blood pressure or a urinary catheterization or a dressing change, those things that we've been able to watch carefully and see. So those things are actually things that we're still trying to evolve. The thing that I really love about this idea is that we think about this COVID-19 as a disruptor, it's pushing us into places that we have not normally been. And it's helping us to actually consider new ways of teaching, which I think is really going to be the silver lining on the other side of this. KT, if you'll advance the slide, thank you. So remember that first and foremost, faculty are the designers of the educational offerings. We have to create interactive strategies, and we start with the objectives, of course, for each encounter, and we have to develop meaningful learning assignments, and we need to go back to the NACSL standards of best practice. think about what is the pre-work that we want our learners to have before they come into the virtual platform with us. What's our shared mental model around the encounter that we're creating? Is there a synchronous or asynchronous pre-brief that you can record for your learners to listen to so that it situates them into what they can expect? And then, of course, we need activities with scenarios and then the reflection of that. And that reflection can be done synchronously so that you can actually do it with a clinical expert and really bring forth the ideas of what you're trying to get the learner to take away from the encounter. Stories or scenarios or videos are really powerful springboards to really immerse the students in learning. I was talking to a student yesterday and I said, how is it going for you on the student side? Because we're on the faculty side actually designing and creating and thinking we're doing some amazing things, but how does it feel? And she says it's a lot of time listening to things on the internet or on the computer. And so I think that anything that we can do to make it engaging and something that's active while they're engaging in the things that we put up really makes it better. Don't forget documenting. After the dust settles, schools will be accountable to their accrediting agencies about what they did, what was the rationale for what they did, and also discuss how many hours they substituted and what was the rationale for that. So make sure there's someone who's really documenting carefully all those components. So one of the things I think is helpful for all of us is to think about, go back to the Healthcare Simulation Dictionary that's co-published by ARC and the Society for Simulation in Healthcare. And as we're trying to define and do the documentation, we can use these definitions. If we think about what is simulation, I still love Dr. Gaba's definition. And that really is when we're in a lab and able to be face-to-face in the ways that I interpret that definition. There are computer-based simulations, and we're going to talk about those where we have immersive virtual reality, and those are really great substitutions now that we have. And then simulation that's based learning is a way for us to think about taking a case that represents actual learning and helps our students to have knowledge, skills, and attitudes to analyze what they're trying to do in their clinical experiences. So here's the NACSL standards of best practice, and they help us to design our simulation activities, our encounters, our online encounters, and many of these still apply to what we're trying to do. And as you know, this is a free download for anyone to go and look at these, and they're short to read, but are packed with tips and tricks of how to do this and to do this well.
Okay, we're going to talk a little bit about what's happening nationally. And as I said earlier, things are changing by the minute. If you look on the NACSL website, they did a survey of all states, and the regulations are all over the place. I'm going to show you the percentages in a moment, but as of today, things have already changed. There is no consistency in the number of required clinical hours per program. So if your program does 1,000 hours, 25% of that is different than 25% of 500 or 600 hours, right? So there's also a question on hours of sim versus hours of clinical. Is it a 1-to-1? Is it a 1-to-2? In my state, it's 1-to-1. In most states, it is. We're trying to do studies around that so that we can show evidence that simulation is a higher quality than clinical. But right now, those studies are in place. There's a couple of papers out, one by Sullivan et al., that showed that the simulation and the clinical experience, the richness of simulation was much higher than in clinical, where the students were standing around observing. And I know in my state, that's been going on for quite some time. And now with COVID, what's happening is we're not seeing hospitals taking any students on. So it's had a significant impact on students, especially these students who are in their last 2 months of clinical. And what we are trying to do is educate as many students as possible to get them on the front lines as soon as possible utilizing simulation in a virtual way, a computer-based simulation, and documenting everything that we're doing so that we can share that with our board when the time comes. But right now we are in a crisis. That is why we're holding this webinar. And we have to remember that we are in a crisis and things are going to have to be loosened up more than ever before. Here is a current slide, and the references are on the bottom for the folks who did this work in August of 2019 and the simulation committee in Enaxle as of just this past week have updated it. So as of today, up to 50%, we have 17 states that can use up to 50%, and Oregon is moving to 49 soon. Washington, DC, and Oklahoma are the two that are at 30, and up to 25% are 7 states you can see there. The remaining 25 states have no regulation about the use of simulation. And Texas, Washington, and Virginia, as of yesterday, a few days ago, have loosened up their regulations due to COVID-19. In my state in California, the governor spoke yesterday and is really deferring to the Department of Consumer Affairs and our board to loosen up those guidelines. They have not been loosened up at this point. We will find out very soon what the next steps are in California. Although we are at 25%, a recent survey revealed that the schools are, for the most part, not using it to its max. So this is the time for those schools that are only using 18% to bump it up to 25. We have students who are desperate, we have schools who are desperately looking for more simulation and are going above around the country and documenting what they're doing. So I think the other question is, you know, when you look at a definition of simulation, does your board of registered nursing consider simulation to be mannequin-based? Do they consider it to have a pre-briefing, a sim, and a debriefing? Do they count computer-based simulation? At this point, everything is up for grabs. And so the whole idea is we're training as many people as we can on how to do computer-based sim, virtual sim, using Zoom, and hopefully meeting the needs of our patients and our healthcare workers. The regulations are going to have to change, at least on the short term. And our hope is that once we can show that we can make a difference and our outcomes are unchanged, that we won't go back to where we were, that we'll stay where we have been having success.
KT, there's a post in the chat box that Michigan just passed an executive order that 100% of clinical can be or a similar online format until the end of 2020. Looks like Ohio did the same thing.
So Michigan and Ohio, thank you guys for that. I'm going to update that slide. Michigan and Ohio.
Same
like
in
I
Indiana.
said, it's changing minute by minute.
Minute to minute.
So everyone's going to go to that, and California's still going to be talking about it. We'll see. Okay, so thank you for that. I will update that and make sure Enaxle knows about that as well for the update. Awesome. All right, so the NCSBN, so people look at the NCSBN in terms of their role, and what they have done has been disseminating data to every state on, you know, the study that was done a few years ago, and whatever they have. But the states, it's up to the states to make the decision as to what they're going to do. If you go into this link, the ncsbn.org website, they have a couple of things of interest. One is the emergency response by state and nurses to COVID-19 and the impact on the nursing regulatory bodies. So I did not see Ohio, I think it was on there, but it could be up there now. But this is an updated list from the NCSBN on what's going on at the state level to their knowledge. But that's another resource. So simulation, is it the answer? It isn't the answer to everything, but we think it can play a large part in getting these clinical hours that are necessary for these students to graduate, to complete their semesters, to complete their programs. And we need to educate as many faculty as possible because we don't want faculty just to do simulation without being trained. And that's why Carol reviewed the standards. We really feel that everyone needs to be trained in sim before doing it, whether it's online or in person. Carol, pass it over to you.
Thank you, KT. So, Carrie Eaton is at the University of Connecticut, and it's like these like minds were coming together all at once, trying to create a list of resources that were possible for people to use in their planning. And so she connected with KT and I, and we began to add to her list that she began. And simultaneously, Anaxel was working on creating a virtual learning resource list. And so this is actually, we have now partnered up with Anaxel, and Carrie is giving her table to Anaxel to be integrated into their platform. And so KT is going to put the website for Anaxel's learning resource list in the chat box at this point, so you can actually link to it. But the thing that I wanted to point out is they're looking at different categories, and these categories may expand over time, but having some webinars posted there and virtual curriculum teaching tools, as well as association, university, and corporate resources, and then social media kinds of things and policy changes that KT's just gone over, the temporary changes in healthcare simulation regulation and miscellaneous. We're asking for them to add another category that's around faculty development for the very reason that KT was just speaking to, that if we could put resources that are easy for people to get to review and or educate themselves on the use of simulation, that would be really helpful. So, and you also may be able to submit your own resource for consideration. So this list is not intended to be all encompassing because it's impossible. So many things are bubbling up, but rather if you know of something that's not there, please submit it so it can be considered to be added to this national and international resource list as people are trying to create these virtual learnings that really integrate a simulation flavor so that we can actually have the engagement with the learner.
Carol and KT, lots of chatter in the chat box about IPE. So
Yes.
We're speaking about Anaxel here, but if you could just take a minute and talk about how these resources would be relevant to other disciplines as well.
So I'm actually going to ask Anaxel, and we're in the process of discussing this, about making some sort of indicator about interprofessional education resources when something is more than just nursing. And they're going to be doing that. But there are several on there. One is Aquifer as an example. And there are, I believe it's the Oxford Medical simulations. There's a variety of things that are interprofessional. And also the thing that I've learned, like KT was saying a few weeks ago, we were just Zoom kind of novices, and now we're becoming Zoom experts. But in our school, we're looking at ways to do Zoom encounters where the students get broken out into groups, interprofessional groups, and they can have a discussion around the case that's presented, and then come back together as a larger group and bring up the points that they learned from, with, and about each other around that case discussion. And so that's a way to engage interprofessional learners in that way. And we were just working on a case yesterday that actually will be doing that this summer, where we're trying to bring the students together to discuss cases and to realize how we come out the case differently. And that's a good thing. It's actually the way that we want it to be, because if we were all, for example, looking at it from nursing's point of view, I would miss the 360 view of the patient. So my expertise is much more valuable on a team when I have the voices of medicine, nursing, OT, PT, nutrition, whatever is needed for that patient, and being able to then immerse our learners to consider who else is not at the table that I would need to have a complete plan of care for this patient. And so interprofessional encounters can be done, and I think when the Zoom platform breaks out into breakout rooms, and those breakout rooms gives time for smaller groups to come together, discuss more critically the case, and then come back together into the larger room and discuss it more globally. So I really appreciate that question, Kathy. So thank you for that, because I do think we can't forget that we need to continue to advance in a professional education in the midst of us focusing in on our professional education. That kind of, you know, if you think about it, we got pushed into this somewhat unexpectedly that we were going along, and then all of a sudden now we're going to be online. So we immediately dropped back down to what was familiar, which is how do we train our learners. But now we need to relax a little bit and back it back out about how do we train our learners also, and how we do that in a team.
And Carol,
So,
let me just
yeah.
add one thing. You spoke about chat rooms or breakout rooms
Yes.
on the Zoom, and I know that the Society is holding a webinar next Tuesday on how to use Zoom.
Oh, good.
And that's free, so I might encourage people to do that. And I also wanted to add that although we spoke earlier about nursing specifically, because that's such a large volume and a critical issue right now, the state of California is also looking at getting medical assistance and LVNs and as many healthcare workers as possible up to speed to hit the front lines. It isn't just about nursing. And I think that that even Carol and I are nurses, and sometimes that kind of slips out, but we're totally committed to interprofessional education and getting as many healthcare workers into the front lines as possible and taking care of the ones that are out there.
And if you're listening to the testimonies of people who are the frontline servers of COVID-19, it is all about their teams. And so being able to communicate effectively in day-to-day care as well as in crisis management is really crucial in this time and beyond. So I wanted to point out one other thing on this list that's going to be there available is the Global Network for Simulation in Healthcare is actually designed specifically for interprofessional education encounters of teams. And so these are built around patient stories, and that's a free resource, free before COVID, free after COVID, and it's in that list. So it's gnsh.org. And those cases are intended to be 30-minute encounters around teams who are able to discuss a patient case that's a sentinel event and to consider ways that they can prevent that event from happening in their setting. So we're hopeful that that will be also another rich resource of training. Next slide. So we know that our simulation centers are closed because of the COVID-19 and the social distancing. But I think that we realize that simulation is not bound by four walls. And it's actually, remember that as the educator designer, we can take bits and pieces and put them together to create really amazing encounters. But there's also our vendor partners who are out there. And many of our vendors are being very responsive to the COVID-19 pandemic by offering free or discounted products. And as such, I would suggest that you contact your vendors that you have relationships with, or even those that you don't, and talk to them about what they're offering during this time to help you to get through this period of online training or teaching. We've just represented a couple here. These are some that we're using, and you want to search for meaningful interactive activities to engage your learner. And one of the things that I think is really helpful to look at is what is it that fits best to the objectives of this encounter so that you design the right thing, so the right tool fits the right objectives that you're trying to do. And then the Shadow Health and Safe Medicaid are addressing some of the patient safety issues that we have out there. Shadow Health is looking at, for example, and this is one that we've been using before this, that looks at clinical reasoning and building that and helping people to understand it and develop those skills in that. And then Safe Medicaid is addressing how do we really train students in a much deeper way about medication administration, conceptually, how do they understand orders, put them into ability to calculate in a formula, and then actually the technical skill of giving the medication. The thing that's really nice about that is really going to improve the performance on preventing medication errors, and that is an important patient safety issue, as we all know. So on the Anaxa website, taking Carrie's table and the ones that we added in, they're going to be adding many, many resources. And so not to be vendor specific at all, but to be vendor inclusive. And so if there are people who are out there who would like to have their resource added to that list, again, I point you to the Anaxa website, click here to submit your submission, and it will be reviewed, because we want this to be as broad of a breadth and depth of what is available, so that the designer, the faculty, the educator can go there and pick out the pieces that fit best to what they're trying to accomplish with this set of learners at this time.
I have put up a few links of some YouTube videos that are out there that the California Simulation Alliance developed. They're free, and we have been using those through Zoom, having the students view the scenario. We assign them roles, and then we debrief it on Zoom. We also have opened up all of our scenarios for open access until the end of May. So anyone can go onto our website and download those scenarios. And many of them are IPE, they're leadership. We've got some LGBTQ, we've got communication. We have about 100 of them that are up to date and current for anyone's use. And I think, Carol, did you talk about the faculty development piece yet on that form? We have a section for faculty development on that list that's on the NAXL website.
I'm sorry, it took a minute to unmute. Say your question again, please.
I said, did you mention the faculty development section yet?
Yes, we added the faculty development, and we're going to talk more of that as we close out the slides, because this is a golden opportunity, I think, for people to understand exactly, or at least begin. I mean, there are many of you who are on this call who are CHESI or who are very well trained in simulation, but there are others who are beginning to see that this is something they want to know more about. So we want to give you the stepwise about how to do that. And we'll talk about that in just a few minutes. But the resources are also going to be on that website as well.
Okay. So we want to talk a little bit about online OSCEs, the objective structured clinical exam. There is a paper by Prettyman et al., which is listed here. And we are finding that many schools are using OSCEs via Zoom or other platform. And we asked the nurse practitioner group out there whether those regulations have been loosened up for simulation for nurse practitioners. And this is what they said, according to NOMF, and here's the link for their statement that simulation can be used only above the required 500 hours that the students are required. So if you're in a school that's doing over 500 hours, you can do those in simulation, but they can't be part of the 500. The statement is here, but I would encourage you to go to the website to read further about that. And the article that I posted on the previous slide is from an online NP program. And they had lots of success with online OSCEs. And I would think this could be applied to medical school, DO school, PA school, and others. So it would be a good read for you. So I wanted to just throw these things out for you to think about and to ponder. When we're looking at our learning outcomes, what do we want our students to achieve? And then what is the best modality to meet those goals? One of our faculty at USF actually created a simulation in her garage. She set it all up and she videotaped it, had her students Zoom in to watch it. She had her daughter as a standardized patient. And so that's very creative. She didn't have a mannequin, she used an SP. I'm hearing too that a lot of SPs are still being utilized right now because, you know, they're with the crisis, things have changed so dramatically, but an SP could actually be in a room or in a breakout room on Zoom in a chair, and you could meet your learning objectives of communication, eye contact, all of these things with that patient, going through your list of questions in terms of your assessment, and the SPs are scripted to respond, and this is all online. and other students can observe as active observers. So that's all happening. We cannot stress enough to keep track of everything you do related to SIM and how it ties to your learning objectives. So when everything is settled, the regulatory bodies will come back and ask you for that documentation. We heard that the Pearson testing centers for NCLEX were closed down completely, which is now turning, and they're opening them up. I think it's either they just opened up or they're all opening up 60 sites around the country for students to sit for their NCLEX exam. And some of the states have loosened up requirements and allowed students to be licensed early on as an interim permittee if they've met most of the requirements and are either letting their clinical hours that they get in their first job as an IP apply towards the total hours that were required. Other states have not gone in that direction. We are hoping that California will consider that as well. We've got 14,000 graduating nurses that need to graduate, and we need them in the hospitals and health systems around the state. We have medical students that are about to graduate. Why not use them as well? Some states are already doing that and loosening up their regulations. So I think that together as a community, state by state, that we should listen and pay attention to what other states are doing, because at the end of the day, it's really about our healthcare workers and our patients. And so with that, we want to talk a little bit about the faculty development piece, because we know that there's lots of folks out there that aren't trained in SIM and are going to start having to use SIM because they have no other choice. Carol.
So we believe if you had a 3-part way of training your faculty, to first have your faculty read the NACSL standards. And if you're going to read one first, I like reading the simulation design one first, and then follow through with the rest of the standards. And then George Washington, under the leadership of Pam Jeffries, did an Essentials in Clinical Simulation across the Healthcare Professional MOOC. And this is a free MOOC. That's 7 modules that you can take, or you can pay $49 for a certificate. But that is a great way for an overview of simulation, from what is it to the point of designing a simulation lab. And then thirdly, as we know, the Society for Simulation in Healthcare has a certification. And so more and more of our faculty are moving towards that certification as a mark of what they have, what they know. And there's 2 levels. There's the regular CHESI and then the CHESI A for advanced. And so the credentialing there, while you may not be quite ready to sit for the exam, there is a lot of resources there that help you to get ready for the exam. And that's an educational process, as well as looking at those resources and the articles that they suggest that you read is another way to get your faculty up to speed about simulation, who maybe have not had an interest or been able to have the time to do that. And this may give them time to do it when they're not commuting back and forth to work. But I also recognize that many of our simulation faculty and even our students are actually on the front line, and they are actually delivering care in the midst of trying to finish in their degrees or to teach. So it is a complex time, but we just wanted to give this map of a way to kind of start with faculty development around simulation. And I wanted to touch back, if I might, KT, with something that you said about the standardized patients. One of the things I think is really quite interesting about that is because lots of telehealth is beginning to bubble up now with the social distancing. And so it is a perfect time to teach our learners in a telehealth kind of model, so that they actually call up, like KT was talking about, a standardized patient, have a visual, and do their encounter like they were doing telehealth. Or if you wanted to enhance it to make it like it's a clinic visit, and of course they can't be doing the physical exam, there might be a way that they could, once they ask the right questions, a slide can come up with the physical exam results for that case, and the pieces could come up as the standardized patient could reveal them at the time that the student asks the right kinds of questions for assessment, in addition to history taking. So those are ways to kind of engage learners. I know that our schools around us are still engaging their standardized patient in those virtual learning opportunities because they lend themselves to that. So before we move to questions, we want to make sure that we come back to the fact that we want you to extend patience and grace to yourself. You're doing the best you can. You're doing some really creative things, and you're considering lots of different ways of teaching and giving them a try, maybe sometimes for the first time. Also provide that patience and grace to your family and friends in the house in which you're living, or those who are around you that you can connect virtually. Because there is this, we're social people, we're meant to be together, so there's needs to be ways for us to connect and to also find out how others are doing. Our learners are people in the midst of this crisis too, and so we need to remind ourselves of the grace we need to extend to them. And then I think sometimes it's hard to understand the decisions that administrators are making, but they're trying to take in the data from the experts and make informed decisions, so that patience and grace extends to them. And of course, keep uplifting and reminding and encouraging our healthcare workers who are on the front lines, who are actually putting their lives at risk, and those of their family as they try to take care of the people with COVID-19. So we're asking you to do what you can where you are to decrease the spread of COVID-19 for sure, but also the anxiety associated with the pandemic, whether that's in your educational realms or in your personal realms. We want you to be sure that you're taking care of yourself, because we want you to continue to engage in simulation on the other side of this pandemic.
Carol and KT, thank you so much. We have some questions. If we could share those, we've got a little time. So first off, lots and lots of links being posted in the chat. This recording will be up on our SSH YouTube channel by tomorrow morning. You'll be able to go in and see the chats along with the conversation here with the live conversation. So if you missed some of that, don't worry, it will be coming. You did address this at a loss on how to train all semester clinical instructors how to do SIM. There are too many. You did touch on this with faculty development. Anything else you'd like to share with our audience about that topic of teaching semester clinical instructors how to do SIM?
I'm going to let KT respond in just a minute, but I really love the idea that we have this opportunity, that, you know, necessity is sometimes the greatest friend of invention. And so I would approach this with an inviting and encouraging attitude. And like, I'm so excited that you want to know more. And you know that SSH and Anaxel are wonderful resources. And ASPE is a great resource for standardized patients. So they don't have, oftentimes faculty are involved in other areas of expertise and may not have any reason to know the simulation databases and knowledges that we do. So be sure that you're giving them those resources and being there, come along beside them and be their encourager.
Yeah, I would add, we at the California Simulation Alliance are offering some free courses over the next several weeks. We have about 16 faculty for the CSA, and they have offered their time as volunteer to do these courses. And the first one is tomorrow, and it filled up in less than 2 hours. So we're going to be scheduling a couple more of those, and we're going to be recording those. I think that the Coursera course is very important for anyone who's never done SIM to take a course like that before they go into just a debriefing course. You can't just go and take a debriefing course if you don't know what the foundation of SIM, the pedagogy of SIM is. So look for those courses. And then as we train more faculty, our goal, I think, is to do a train the trainer model, to have as many trainers as possible out there in our states to train others, utilizing the CHESI guidelines and the accreditation standards and the Anaxel standards.
And one more thing about this, I think that oftentimes people are scrambling so hard to get something up that they are taking what is kind of a static case study and putting it on line and hoping that it's simulation-like. And I think if you can be a reviewer for your faculty and talk about, encourage them to say, is there some sort of story that we can bring in that they can either hear auditorily, like Story Care offers auditory, NLN has auditory monologues with patients, or if they can actually have something that engages them more than just watching, like stop at this point and now write out whatever, your care plan, your S-bar, whatever needs to happen in the case. So they're not just statically sitting there, but actually engaging with the content, trying to apply it in a way that will be meaningful for them when they go into practice. And then that case study becomes vibrant then, instead of a flat piece of paper that it was maybe prior to this time. And then do the debriefing in a synchronous way. Come together at an appointed time and discuss the case together so that they can learn with and about each other's interpretation of what happened in this case.
Thanks for noting the Coursera course. I'll try to get that link in here before we end. I'll try to get that into the chat if anybody else has that, Andrew. I think that's the one that Susie and Pam Jeffries are involved in, and several others.
It's also on the slide deck, Kathy, if you would like to pull it from there.
Yeah, and the slide deck will be posted. We'll have a PDF of the slides available on our SSH research page, so you'll be able to find it there. Thanks, Carol. That's perfect. A question, our hospital will soon be training on provider redeployment. Would love to see what others are doing on that front. Anybody on the call? Or KT and Carol?
So I know that there's a call out for people who are coming out of retirement, or ways to bring people back into frontline care that maybe have been away. And normally we would put them in a simulation lab, right? But those simulation labs are not necessarily functioning at full capacity. So I think that the point is what is it that you can do that is virtual that would help them get ready? And I don't, there's some things that are out there. I think the Novex is one of those that actually can help them begin to think about their clinical reasoning again. But it depends upon what you're trying to do. Are they going to be frontline workers? Do you need to go back and review how to do PPE and keep yourself safe with a respiratory patient? And it depends upon the objectives of what is it we're doing to bring in those folks back into frontline care.
Anyone on the call have experience with this yet? And I know it's a topic that we're thinking about.
Yeah. Kathy, I know that in the Bay Area, they're doing surveys of all the nurses that work in the hospital that aren't in the clinical arena, and doing a survey to determine what skills they need. And then they're training them in the hospital on those skills and then deploying them accordingly. And it may be a quality nurse or a admissions nurse that hasn't worked in clinical for a while. It also may be a med-surg nurse or a physician that is a med-surg person who now has to go to ICU. So skilling them up on intubation and respiratory cases, and they're doing that internally.
Yeah, okay.
Yeah.
Thank you, that's great. And
I would also offer the YouTube. Now, if they call me back, it's gonna take a little bit more time to train me up than others, but I would look at a YouTube video of a sim, and I would pause it before they do what they're doing, and I would think, what would I do? And then go forward. And so you could actually get a lot from looking on the simulation YouTube videos that are out there.
It's great advice. Anything else on redeployment that anyone can think of? Okay. Our next question for NP students, does anyone know if the students need to be directly observed during simulation, or can they be recorded and discussed later? Anyone? Again, I'll read the question. NP students, does anyone know if the students need to be directly observed during sim, or can they be recorded and discussed later? Anybody have any experience with this?
Not being an NP expert, but working with NP colleagues at my school, I know that in a virtual manner, the faculty is always on with the student on the Zoom. I have not heard about the recordings yet, but I don't think it, I'd like to hear more about that, actually.
I don't remember who posted this, actually. Try to find this quick while I ask the next question. KT and Carol, let's come back to that one. I'll try to find out who asked that.
I posted that question. Now, this is Jason from DeSales.
Go ahead, Jason. Tell us a little more about it.
So my faculty are wondering if it's possible for them to do a simulation with a standardized patient through a Zoom encounter or through any one of the video encounters that you're discussing. Would they have to be present while they're doing the experience, or can the experience be recorded and then watched by the faculty later or debriefed at a different time?
And Zoom has that capability.
So in the chat, Amy Daniels brings forth the reminder that we have to be careful about the legal ramifications of videotaping. And as you know, the standards and the certification for centers make sure that you have some sort of document that talks about not only consenting to be videotaped, but also how you're going to manage those videotapes after you collect them. At what point are you destroying them, and how will they be destroyed? So I think that that is a cautionary warning that Amy brought forth that's important to consider, even in this videotaping here. Going back to your question, Jason, and this is just a dialogue because I'm not a nurse practitioner either, so I think it would be better to get that from nurse practitioners. But it seems like to me that a faculty member is not present during the whole time that a nurse practitioner is in a clinical site, and so is not observing everything that they do there. So if there's agreement in a way that people has decided how they're going to manage videotaping, would they be able to videotape, watch it, give feedback, and then decide how they're going to store it? Now, once we're videotaping on Zoom and these open access kind of devices, we need to make sure that those are secure. And how will you actually keep them secure and delete them afterwards? And I do not know the answer to those.
Hey, Carol, this is Chad Epps. Can I make a comment?
Sure,
Chad, please.
I don't see how this is any different than what we do every day in our sim center. So we have students interact with SPs all day long. We record them on our system as Beeline, and then faculty go in later and assess the student. So I don't see how that's any different than doing the same thing on Zoom.
Thank you, Chad.
Thank you, Chad.
This is Alan Ecker from Rowan University School of Medicine. How you folks doing?
Yeah.
We use Learning Space from CAE in our center, but we've been able to link our Blackboard program of CAE Learning Space to our students' accounts with their email, so that when we do an encounter online, the student can review the encounter, but also the grading professor can go back in, just as if we were actually in the sim center. They can go back in and retrieve that data information with their access code through CAE in order to get that information. So it's a little more secure for us, but we do it through the WebEx Blackboard of the university.
Okay, great. Thank you, everybody. That was a great, that was very helpful to get that clarified. Last question I'm harvesting out of here. Has anyone created a virtual sim experience for OB hypertensive emergencies or eclampsia? And if you have some examples of that, go ahead and send those to us in the chat. A little bit more specific virtual sim for OB hypertensive emergencies and eclampsia. All right. Any other questions that I haven't caught out of the chat that someone online would like to ask? Got a few minutes left, and Carol and KT are anxious to help. So if there's any questions looming out there, don't be afraid. Someone else is probably thinking the same thing.
Hi, I have a question. This is Rose Kranziasime from Massachusetts. So my question is, if anybody out there have a way, because our students in the final semester are probably going to be pushed into going to work right away. And we are struggling to come up with, how to prepare them for the COVID. So is there anything anybody is using to prepare their senior students to go out to the workforce to, take on COVID-19?
On the website that Anaxo is putting together, there are a couple of COVID simulations that are available virtually. And so I saw one from CAE, there may be others. So I would go there and look at those and see if they would meet your need at this point as a start. And I believe that there are others who are developing other COVID simulations that might be helpful in preparing the learners for these encounters.
Thank you, Carol.
I have a question for the gentleman who just spoke about CAE Learning Space and connecting to their university Blackboard.
Alan?
Yes.
What are you doing with that then? Is that just for when you're, before we had the crisis, or what are you doing with that link now?
We have a data backup with CAE. We pay for a data backup storage, and we maintain those records for 4 years. In the event that there's a, let's say a student wants to dispute a grade or something like this, and then at that point we erase those files so that, so we're always, every year we're erasing the 4 years ago. So then the next year we would be erasing. So it's always 1 year step back, but we maintain those for the purpose of the students' time in the university itself. But afterwards we do delete those. But we don't maintain those. We pay for a backup storage through CAE.
Right, because I have the same thing, but what I was trying to think of was how we could use what we already have taped, but because of the, privacy regulations and all, unless you got, consent from everybody, we were trying to figure out how we could use already previously taped simulations to show to others, but you'd have to get consent from everybody, and we delete ours every year. So
Right.
I was just wondering if you were using what you had at all.
Yeah, in the student handbook, when they are accepted to our university, it outlines video recording, the use of that storage data, and maintaining that record until they graduate. So they sign a consent waiver at year 1, and then once they've graduate, go on from their clerkships into their residency, then we start deleting from that point.
True.
So Nancy, I think that your question is a really important one, because I think Alan is talking about for the individual learner, and you're asking, can we take the individual learner, things that we've recorded and use them from simulation training now? And I agree with your caution that you cannot, because that is not what they were designed for. But remember that KT has some YouTubes out there that are simulated students that are in simulations, and so those are usable to train students with. That students can actually watch those, consider themselves being in X, Y, and Z role, and then actually be debriefed by their faculty in the care of that patient. So I would go and look for those CSA YouTubes around simulations that were designed for training.
And where were those again?
KT, can you give that link? I think she gave it earlier in the chat box.
Yeah, it's just CSA health impact simulation in the search on YouTube. I don't have the exact URL because I'm in the screen mode, but I did put it in the chat.
CSA health impact on YouTube.
Yeah, or you can just email me and I can send it to you.
Okay. Thank you very much. Yes, Carol, that was exactly what I was asking, because we were examining that to see if there was something that we had already previously taped that we could use, and we thought not. So
I agree with you.
yes. Okay. Thank you very much.
Okay, anything else? I bet we could go on for a long time here. We are running Monday open forums on this on SSH's webinar platform on Zoom. We'll be running those every Monday at 2 p.m. Eastern, 1 Central, 11 a.m. Pacific, to discuss things just like this. I've been gathering a list of topics from our discussion today that we will continue to work on through the open forum on Mondays. That will continue indefinitely throughout COVID and beyond, so that we can help you support the work that you're having to do, bringing clinical sim and everything else you're trying to do out there. So anything else quickly before we adjourn?
Kathy, thank you so much for wonderfully managing the chat. That was very helpful to make sure people's voices were heard.
Yeah, thank you, Kathy.
Thanks to Katie and Carol, to everyone who hopped on today, to our staff for helping us through, Andrea, Christina, and Andrew. Join us on Mondays for the open forum. We do have another webinar next week about bringing SIM online, this one from a bit more of a medical school perspective, although it will be applicable to every discipline. That one being brought to us by WISER, the Winter Institute for Simulation, Education, and Research at the University of Pittsburgh. John Letts will be facilitating that discussion, and we ask you to join us. Again, that is another free webinar, and registration is available. Have a great afternoon, everyone. Hang in there and stay safe.
Thank you.
You too. Bye.
Bye.
Thank you all.
Thanks.